Hello, my name is Dr. Elisha McCoy and I'm a general pediatrician at Bonheur Children's Hospital. Today we're going to talk about lice. Anyone can get lice. There are many myths and facts out there about how lice are spread. So today we're going to talk about the facts. Children can get lice from spread from one person to another. It's contact to contact. Lice can't jump or fly, and so they crawl, and they can spread from person to person through brushes, through hats, and through other products, personal products. And so it's important to teach your child for prevention of lice to not share those items with other children or other individuals. I'd like to introduce you to my friend Grace, who's going to help assist me in showing you how to look for lice in your child's hair. So things that may prompt you to look for lice in your child's hair include a note from school stating that they have found a child that has lice, or your child may complain of an itchy scalp. And so I'm going to demonstrate on Grace how to look for lice and nits in your child's hair. Depending on whether they have long or short hair, this may be an easier or difficult process, but I would recommend first starting around the ear, behind the ear, and along the hairline, especially the nape of the hairline. And so as you look along there, a lot of times it's easier to find the nits. Additionally, in someone with longer hair, a lot of times it's better to divide it into sections. And so you might want to pull part of the hair to the other side, rubber band it, and then you want to go piece by piece through the hair using a fine tooth comb. And so as you can see, we're brushing through the hair and looking very closely for any nits. Now I will tell you that you will probably not see lice because they, with the movement, will run away from you looking for lice. But you might find the nits, and you're going to find them closer to the hairline, like I said. You're also going to probably find them approximately a centimeter from the hairline, which may suggest that there's an active infestation. If you were to find nits or lice in your child's hair, there are many over-the-counter products that you can use to get rid of the lice. Products such as Rid and Nix are available over the counter, and you can get those without a prescription. I would encourage you to follow the directions very closely, paying specific attention to how to apply the product and the age limitations on the product. Because several of the products require more than one treatment, you should follow the instructions and treat, and then wait approximately 7 to 10 days and then retreat your child. If you still find that you are seeing nits in the hair after the second treatment, then you want to seek advice from your pediatrician for other possible treatments or to see if you're following the instructions appropriately. So as you can see, we've gone along the hairline, paying particular attention to the edge of the scalp and getting through all of Grace's hair. And you would just continue that process until you've done this entire section, and then go to the next section until you've looked at the entire scalp. So if you find lice on your child and have treated them for it, you want to make sure that you check all adults and children in the household for lice as well, and treat those that you find lice on. In addition, you want to make sure to take all of your linens, bed linens, towels, and clothing, wash them on the highest setting in your washing machine, and then dry them on the highest setting, and that will kill any lice that are remaining. You can vacuum your carpets, but there's no need to spray for lice. In addition, for things that cannot be washed in the washing machine, you want to bag those up, seal them for 2 weeks, and then you can remove them and they can be used again. The most important thing is to tell your child that this does not mean that they're dirty or have a hygiene problem, and there are no long-term consequences due to getting lice, because it is common. And so if you have any further questions, please contact your pediatrician and they can guide you with any other questions you might have.